Well, good evening, everyone. I'm Supervisor Lisa Bartlett, Supervisor for the fabulous 5th District. And joining me this evening, we are joined by Assembly Member for the 73rd Assembly District, Laurie Davies, and our Public Health Officer and Healthcare Agency Director, Dr. Clayton Chao. So thank you all for joining us this evening. We know that many of you have questions regarding the vaccination distribution, scheduling appointments, reopening the economy, and what to expect moving forward. We hope the information we provide this evening will help answer those questions and address any concerns that you may have. My district includes one of the largest senior populations in Orange County. Just the population of 65 plus is over 140,000 residents right here in South County. As such, it is a top priority for me to ensure that our seniors have options to receive the vaccine as quickly as supplies are available. So let me begin by giving you a brief update on the status of the vaccination distribution process and what you will need to do to register for an appointment. Orange County has a population of 3.2 million people, many of whom are very anxious to receive the vaccine. Vaccines are currently being distributed per federal and state guidelines to individuals who fall within phase 1A, all tiers, law enforcement, working in high-risk settings, and those over the age of 65. To put this in perspective, in a county with 3.2 million people, the number of individuals currently eligible to receive a vaccine in phase 1A is approximately 660,000. So a lot of individuals, and we don't have nearly that many vaccines. Now, the county operates 2 super pods, or the points of dispensing, right here in Orange County. One is at Disneyland in Anaheim, and the other one opened up recently at Soka University in Aliso Viejo. The super pods operate from 8 a.m. to 5 p.m. 7 days a week. And I want to clarify a misconception out there that Disneyland and Soka are the only 2 locations dispensing vaccines. That's not correct. There are actually many locations throughout the county. The county receives its allocation of vaccines from the state of California. Of the amount received, 80% is distributed directly to hospitals and community health centers. So the remaining 20% of the allocation that comes to Orange County actually goes to the 2 county-run points of dispensing. So I hope that clears up some of the confusion relative to people on the distribution of the actual sites and the vaccines. Relative to Othina, which is the county app that we're using for scheduling and registering, let's talk about that specific process. But before I begin, let me tell you that I'm fully aware and totally understand the frustration that people have been experiencing in terms of the registration process and the length of time that it takes to secure an appointment once you're registered. I will address both of those issues in just a moment. Appointments are required to be vaccinated. Appointments, yes, are required if you want to be vaccinated at a county-run facility. Anyone showing up at either Disneyland or Soka University without an appointment will not be seen, even if they fall within the eligible phase group. And the reason for that is we only have scheduled appointments up to the amount of vaccine doses that we receive. Individuals can register for an appointment via the othina.com website, or a smartphone application is available in the App Store or in Google Play. So let's talk about the issues that I'm hearing about in terms of the registering process and also securing an appointment. The software developers of the Othina app recently released some new updates to address some of the technical issues and glitches that were simply part of the process. And unfortunately, when you have new software, this is something that we have to encounter, but they're working very diligently to get those items fixed. So the updates now include a digital waiting room where registered individuals will be placed until an appointment becomes available. So due to the high demand and limited supply, this may take some time, but I ask for your patience. We cannot set up appointments for vaccines that we don't have. Appointments are prioritized based on age, time of registration, and availability of vaccines. Regrettably, we're at the mercy of the federal and state government in terms of the number of vaccines allotted to Orange County. When an appointment becomes available, you will receive a notification via email or through the app. Please check your email frequently, including your junk and your spam folders, because the email is going to invite you to actually schedule your appointment. Once you receive an email, you'll have a 4-hour window to log in and to schedule your appointment. If you miss the first email notification, don't worry, because you will not lose your place in line. You will receive 2 additional email notifications to set up your appointment. And if you have not scheduled your appointment following the 3rd notification, you will be removed from the priority list. So it's really important to check your emails and go online and schedule that appointment. If you're experiencing an issue registering through Athena, we have also set up a healthcare hotline, which is 714-834-2000. So 714-834-2000. Trained operators are available Monday through Sunday from 8 a.m. to 5 p.m. to assist you. The hotline also offers automated responses to frequently asked questions 24 hours a day. On the day of your appointment, please don't show up more than 30 minutes ahead of your scheduled appointment time. That will have you stand in line the least amount of minutes. People who come hours before their scheduled time are going to be in line for hours before their scheduled appointment. And we're very, very efficient about getting people through the system. Once you arrive for your scheduled appointment, it takes about 45 minutes or less at our pod sites. While waiting to receive a vaccine, it's incredibly important that we continue to protect ourselves and our loved ones during this time. So please continue to adhere to the health and safety guidelines. Wear a face covering, keep your social distancing, and practice good hygiene. Well, we're not out of the woods yet. We are getting there, hopefully very, very soon. So at this point, I want to turn it over to Assemblywoman Laurie Davies. She's the newest member of the State Assembly representing the 73rd District. She's the former mayor and city council member for the city of Laguna Niguel. She is a good friend of mine, and I'm just delighted that she's in our State Assembly representing our district now. And at this point, I will turn it over to Assemblywoman Laurie Davies.
Thank you, Lisa. I appreciate it. First of all, good evening, everyone, and thank you so much for joining this event. I want to start off by saying thank you to Supervisor Bartlett, as well as Dr. Chau, in putting this event on, and also thank you to the staff that has really worked hard to do this. Obviously, you know, I can tell you up here at the state, we're trying to do as much as we can to get things moving. We're frustrated, I think, like everyone else. This is a federal and state run. And obviously we're trying to get things going with the county. So do know that we are up here, we're fighting and obviously trying to get them to improve. I did have a meeting today with Dr. Pan, along with our other legislators, and they're coming up with a new system that's supposed to be much more fluent, much easier to use, which is great. But they know that they need to do better. And that's what we're holding them to. So obviously the importance is your health and your safety, number one. I can tell you other things that I've been doing up here is I'm working on some bills and working across the aisle to get things done. One of the things I'm doing, obviously, is my priority is to get this vaccination out. We also want to get our small businesses up and running. We want our kids back in school. We want our kids playing sports. But until we can get this vaccination out completely, we'll never have those doors completely open. So obviously that's our first priority. I did introduce a bill, and it's AB 259. It's protecting California restaurants. We know that the hospitality industry was definitely affected some of the most with this COVID shutdown. What this will do is go ahead and take the permits, because every year they have to pay permits such as like ABC permits for alcohol. You even have your corporation fees, but what it will do is go ahead and give them a tax credit for the permits that they had to pay for, 50% last year and then 50% this year. So at least they're getting some type of reimbursement, especially because they were closed. There's no reason why they should be paying for something if they're not open and able to produce revenue. The other one is AB 259 and AB 274. And this goes with EDD. And obviously with COVID, EDD, we've had many, many problems. Sadly, we're up to $10 billion worth of fraud on these EDD cards due to lack of security. Again, those are our taxes, your tax dollars. And so what this bill will do is it will require that there's a security chip on these EDD cards that are going out. Right now, they don't have that. So it's easy for someone just to pick it up if it's lost or stolen and actually get the money from it. this will require it like a credit card where you have to have a PIN in order to get the money out. So again, I've got bipartisan support on this, which is great, and we're moving on that. And then also I've been working with our coaches, let them play. You know, there's no doubt that this has really affected our young kids, and especially those that are playing sports. I mean, they've been stuck inside, grades are going down, they need to be motivated, they need to have you know, this opportunity to be with their teammates. And so we're working really hard to be able to get this sports back up and running. 30 other states have been doing this safely for some months now. So you can always go to Let Them Play if you want to support that as well. And then finally, I'm working with Assemblywoman Petrie Norris. And what that's doing is she has put together a letter to go to the governor. And basically what we want to do is have him give the authorization that nursing students, retired medical professionals, and firefighters can administer the vaccine shots. Because I know Supervisor Bartlett can approve this, is we don't have a lot of staff either. There's a lack of medical staff out there to help. So if we can get this moving, we can get more people out there once we get the vaccination. So we need to go hand in hand on that. And lastly, I think one of the most important things is that we're calling on the governor to finally release data to us about how vaccination distribution is going and where it's forecasted to improve or stall so that Orange County may plan better. As of February 1st, Orange County has administered upward, as Supervisor Bartlett said, 3,000 doses of COVID vaccines. Now, generally due to the vaccine shortage, states are experiencing the difference between vaccines delivery and vaccine administered represents providers holding onto doses so that individuals who received a first dose can get that second dose. Currently, healthcare workers and long-term care residents, which is around 3 million in the state, are part of phase 1A. So phase 1A, they're the ones that will be getting the vaccinations. Then we move to phase 1B, and that would be then age 65, education, childcare, emergency service, food and ag workers, and that's about 8.5 million. So the bottom line is you're looking at around 11, 12 million people. And right now the state has about 6 million doses of vaccinations, and they've already went out 3 million. So you can see we definitely need more coming our way. So I can tell you that's something that we're working hard on. And we hear what's going on here. You can always reach out to my district as well as Lisa's, Supervisor Bartlett's, and we're going to do everything we can because you're our priority. You come first. So thank you so much. I appreciate the time. Again, reach out to me. My door's open. I'm happy to do what we can do. Thank you.
Thank you so much, Assemblywoman Laurie Davies. But rest assured, everyone, that we are working at all levels and leveraging every resource we have, both locally here in Orange County and with our legislators at the state level. We want to get our fair share of vaccines, including getting more vaccines down to the county level. Right now, we are very vocal with the state, and I can tell you every single day we are making those phone calls. We're also working on the hosting pop-up senior mobile clinics as well to vaccinate the vulnerable seniors that are in critically underserved communities. So we've got a lot of things going on. And at this point, I want to turn it over to someone who will probably answer a lot of your questions, our very own Dr. Clayton Chao. He is the County Health Officer and our Healthcare Agency Director. So Dr. Chao, thank you so much for joining us this evening, and I'm going to turn the floor over to you.
Thank you, ma'am. Thank you, Supervisor Bartlett. Thank you, Assemblywoman Davies, for hosting this and giving me an opportunity to have a conversation with our community. Hi, good evening, everybody. My name is Clayton Chao, and I've been working very closely with our Board of Supervisor as well as with our Assembly woman Davies in making sure that if we have any issue, if you have any issue, concern, please come to us, and we'll try and answer your question. There's a couple facts about the COVID and vaccine, and the number one facts that I want you all to know, because you probably hear different story and different rumors. Both of the vaccines that currently have been authorized by the FDA, the Pfizer and the Moderna, even those they are stored very differently, transport very differently, and the time frame in between the two doses are very differently, but they are pretty much the same in that the efficacy rate is over 94% after a week from your second dose. In fact, after 2 weeks of your first dose, it's almost as effective as our seasonal flu vaccine. So that's a good sign. And we do have preliminary data that since the introductions of the vaccine in mid-December, perhaps what is responsible for the drop in the infection rate is because a lot of people who have gotten the vaccine, especially our healthcare workers. So that is good news. There are several scientists are looking at that data right now. The basis of these two vaccines are messenger RNA, which is safe, and it really does not change your DNA. Because messenger RNA is very fragile, that's why it needs to be stored in what we call ultra low freezer temperature. And then when you put it to room temperature, you must use it immediately. Otherwise, you have to discard it, right? And then secondly, the minute it got into your body, when your body recognizes as a foreign body, your body will immediately produce substance in your body called antibody to react to future viral. But the mRNA, the vaccine itself, get destroyed very quickly in your system. So it doesn't have any influence into the DNA and what have you. We do know that there are some minor side effects for a few people when you receive the vaccine. And the most important side effect that people talk about is anaphylactic reaction, is when your airway close up and you have difficult breathing, and they have to give you what they call an EpiPen. The latest information told us that over 40 some million people who received the vaccine worldwide, there has only been 50 cases that are associated with Pfizer vaccine and 21 cases associated with Moderna. That's giving us 5 out of a million chances of doing getting that type of reaction. Most of the side effects that people get is they feel like a flu-like symptom, and then it will go away after 24 to 36 hours. And then obviously, the chances of having those flu-like symptoms are probably more so after you get your second dose than comparing to the first dose. There is no scientific evidence that we know of up to this day to suggest that the COVID-19 vaccine could cause infertility. In fact, worldwide, there's been 23 women who got pregnant in this study out of a total of 70,000 people who completed phase 3 of both of this vaccine. And there's only one miscarriage, but the person who had the miscarriage was on the placebo arm, meaning she did not get the vaccine. And so that is the updated data on it. There's also a question about can somebody mandate this vaccine based on the FDA regulation, because this vaccine have not been approved yet, only authorized for emergency use. A person cannot be required to take the vaccine or any product, anything that the FDA have not approved. You cannot make somebody take it. However, there are some equal opportunity employment lawyer discussing whether or not an employer could mandate an employee get the vaccine based on the nature of their business. So right now, that is a very hot topic all over the country. Lawyers, labor force lawyer have been talking about this very issue. I know of a health system in Southern California. This is a healthcare system that through the legal counsel advice have made it a mandate for all of their staff to get the vaccine. Now remember, these are healthcare provider, and so that entity has issued a letter to their employee that either they get the vaccine or they will have to find a different type of employment. So that's one example that I know of. Okay, next slide, please. You probably heard about our vaccine rollout all over the country, all over California, and including Orange County. We don't have enough vaccine at this point, period. There are currently 702,000 individuals in Orange County who are eligible based on the state criteria as critical and healthcare provider, as well as individual who's 65 years old and older. From the county perspective, we have only received a little bit over 170,000 doses. Now, there are three ways a county can receive the vaccine. The first way is directly from the federal government to CVS and Walgreens to provide the vaccine for the staff and individuals who live in long-term care facilities. We don't know what that bucket look like in terms of how many vaccines belong to that bucket that come to Orange County. Then the state allocate vaccine to what they call multi-county entity, visa entity that have footprints in more than 3 counties in the state of California. An example of those entities here locally in Orange County are UCI Health System, they're part of the UC system, the Kaiser Health System, as well as the Providence Health System. The Providence Health System has 4 hospitals here in Orange County: St. Jude, St. Joseph, Mission Hospital in Mission Viejo, as well as Mission Hospital in Laguna Beach. And then the third way to get the vaccine is directly to the healthcare agency, Orange County Healthcare Agency, and then we in turn distribute it to the non-MCE health system, like Hope Hospital, Memorial Care, Barton Valley Hospital, Anaheim Global, etc. Because remember, the first phase of folks who are eligible was and continue to be healthcare provider. And we in Orange County have not had enough vaccine to even finish the phase 1A. And then we've added individuals who are 65 and older based on the data in Orange County. 3 weeks ago, we looked at our own data and we knew that there are a large number, over 72% of individuals over the age of 65 was occupying our ICU bed in Orange County. And so that was the reason why Orange County and other county in our region got the lockdown, because the ICU bed availability was below 15%. And that's why we went in the lockdown. And we realized that in order to ease that, we really have to go to those who are most vulnerable and vaccinate them. On top of that, when we look at who die in Orange County, 75% of those who have died from COVID-19 were individuals the age of 65 and older. And that's why we were the first county in California that decided, actually the board of supervisors, Supervisor Bartlett was part of that approval for us to move towards vaccinating the most vulnerable and those of the senior over the age of 65. And the next day, the state followed. And as of you know, right now in California is the healthcare provider and the senior 65 and older. And so we know the rollout is improving because we have over 500,000 people now have enrolled themselves, registered themselves on Othina. We have more than 1,000,000 people, 100,000 people who have gotten their vaccine via Othina. So we'll be rolling out the data on the Othina very soon. So you can visit our website and look at those data. There are a different way for us to make sure the vaccine get to people's arm. We have what we call the super points of dispensing that you heard about at Disneyland and Soka University. We have the doctor's office, particularly the community clinic, to provide that. The hospital is also providing vaccine. And then we are moving towards a mobile pod, a mobile clinic, working closely with the city as well as the senior centers. Next slide, please. And I think, I believe Supervisor Bartlett have spoken to you about the superpod. Our goal is when we have plenty of vaccine, that the output for the superpod would be upwards to 8,000 vaccine a day. So that is our plan. We have worked with more than just 5, actually. We have, because entity coming out of the woodworks now, wanting to set up a superpod in their site. And so we are, the team is visiting those possible sites and also working with entity, cities, private entity to look at or lining up the pod so that the minute we have more vaccine come, that we can stand them up very easily. Next slide, please. Is that the last slide? I think that's the last. Here we go. Ahsoka University and Disneyland Superpod. Because of the pre-registration on the Othina, by the time you get up to the registration point into you get your vaccine is about less than 3 minutes, and then adding in 15 minutes of observation for the side effects afterward. In general, folks said that they're able to show up to these 2 superpod sites in less than 1 hour, and then they're done with. Next slide, please. Please come to our website for the latest information, and then also if you are part of these eligible population, 65 and older, as well as our healthcare worker, please visit Othina. I'm happy to inform you that the completely end-to-end Spanish version will be live tomorrow. And then very soon, we will have a Vietnamese version, Korean version, as well as a Chinese version. So that's coming up very soon. Next slide, please. That's it. We want you to get the vaccine. If you have any hesitancy about vaccine right now, it's time to learn. Talk to your friend, talk to your neighbor who had the vaccine. Come onto our website, get onto Othina website or apps to read accurate information about the vaccine. We want to ensure that when we have plenty of vaccines, that we make it available for those who want the vaccine ASAP, and so we can go back to close to normal stage by July 4th. Hence, we activated the Operation Independent on New Year's Eve just a month ago. So I think that's the last slide.
Well, thank you so much, Dr. Chao. Really important information. And we hope that Operation Independence is a success with our 3.2 million residents we have here in the county. I'd like to turn it over at this point to Pauline Colvin, who's going to present some questions from the audience.
Good evening, everyone. We've received several questions this evening. A lot of you have the same questions, and recognizing that we have a limited amount of time, we will get through as many questions as we can. So the first question we have, and this will be for Supervisor Bartlett and or Dr. Chao. Can you tell me and others why it is so difficult to get a vaccine? I'm over 65 and check the Othina app several times a day and often at midnight to see if I have an appointment. Would either of you like to address that?
Okay, so as Dr. Chao indicated, Orange County was the first county in the Southern California region to start vaccinating seniors 65 plus. Part of the reason why it's difficult to get a vaccine goes up to the state level. So the state has a database that we report to, and they need to scrub the database because they're underreporting the number of vaccinations. And the reason that number is important is because whatever is reported, we get vaccines down from the state level. So the state is in the process of correcting its database to make sure that the numbers are accurate, and all of the counties, the 58 counties in the state, get the requisite number of vaccines based on the actual vaccinations that are taking place. And relative to the Athena app, we've now corrected the problem so you don't have to go on every 12 minutes to see if you can schedule an appointment. Once you're registered and your email address is in the database, you'll receive an email notification or a text message that says you've now got 4 hours to go on and actually schedule your appointments. So that's made it so much easier, especially for our seniors who don't want to be up at 2 a.m. to see if their appointment is ready to get scheduled. With regard to the system in LA, so the state has a system called My Turn, which is similar to Athena. It's being piloted right now in San Diego County and in Los Angeles County. And I've spoken to the supervisors in both counties. San Diego is working okay. They've got about the same population that Orange County has. LA has about 3 times our population, and the system keeps crashing. So it's not very successful in Los Angeles. I think the Athena app, even with some of the glitches that we've encountered, is still running a lot more efficiently at getting people registered and scheduled. Dr. Chau, would you like to add anything?
That was wonderful, Supervisor. The only thing I would add is that please be patient. As I mentioned earlier, there are currently 702,000 people in Orange County who are qualified, but from the county bucket, we are getting only 30,000 doses a week. So as you could do the math, there's not enough vaccine for everybody yet. And so I ask you to be patient. The Athena would only open up appointment when we have vaccine, and the vaccine are allocated to the county on a weekly basis. So we can't even plan it out and open more appointment just because we don't want to open an appointment, give you an appointment, and then when the time comes for you to receive your vaccine, we have no vaccine.
Okay. Thank you. Second question we have here, will Orange County be offering a drive-through superpod site? Dr. Chau.
Thank you for that question. We are evaluating it right now because I want to make sure that the 15-minute observation is that there is enough staff to make sure that they pay attention to every single person who's sitting in the car. Because remember, if you're sitting in your car and you're comfortable and you doze off, we don't know, is it because you're comfortable, you dozed off, or is it something happened to you? And so we are evaluating it. We went up to LA to look at the way they do it. I have to tell you, I was very nervous, not happy with the way they're doing it. And so we will be do a very small pilot program first. And then when we are sure that it's safe and this is the way to go, we will roll it out. We know that it will be beneficial for a certain group of folks, but when we compare LA and Orange County, the efficiency is still much more efficient than the LA drive-through site. So
great.
That question.
Next question. Once you are in the Athena app waiting room, how is the order prioritized for residents to receive notice of their vaccine date?
Dr. Chau.
Dr. Chau, I will give that one to you.
Yeah, so like I said, I mean, what we've done is we have people in queue. So you register on the website and you are on a queue. And so what we've done is go by not only the time stamp, let's say how far back did you sign on register, but also based on your age as well. And obviously people who are medical provider, healthcare provider would also get that priority, because currently the state said the first priority would be people who are healthcare provider, then 65 and older. And so again, that's how we go. And then we will open up the number of slots. We only invite those who are eligible for that certain slot to do their scheduling, right?
I know there have been a number of folks that have said, well, gosh, my neighbor got an appointment in 2 weeks and I've been waiting 3 weeks and I still haven't received notification yet. So we just want to remind everyone that we can only give out appointments when we get our notifications of actual vaccines coming down to the county. And so for some people, just depending on where you are in the queue, it might be 2 weeks, some might be 3 weeks, and some it might be 2 days. So just depending on the timing and the phase that you're in.
Okay, great. Assemblywoman Davies, we have a question here, and I know this has been touched on earlier, but a lot of people are inquiring, and I know we can't give a definitive answer to it, but when is there any kind of a timeline that we can expect more COVID-19 vaccines to be available from the state? Do you have any kind of information you could share with us on that level? I know it's hard to pin it down to a timeline based on what Dr. Chao said, but if you could give us some insight on that, that's one of the questions we have.
Certainly, and thank you for the question. I'll let Dr. Chao give more specific on this, but I can tell you what I'm hearing at the state level. Officials are optimistic that there's more vaccines becoming eligible under the FDA, such as Johnson & Johnson plus AstraZeneca. And I can tell you the benefit of Johnson & Johnson is it's one dose only, which is going to make a huge difference. So I'm hearing that's just a couple of weeks away, and I'm hoping that's moving forward. And also, I also just found out today that the federal has allocated $1.2 billion to the state of California, and that's going to be for activity, vaccination distributing. So that's great. So I mean, the funding's finally getting here from the federal level. We've got more vaccinations coming out, which is great, especially again, Johnson & Johnson being a one dose, which will make a big difference, I think. And I was told that we should be expecting to see a lot of this opening up around February 15th. And that's what we were told today. So different counties right now, obviously they're looking at Riverside in LA and doing this. And then the rest of the counties should be seeing a little bit more action around February 15th is what I was told today. And I just want everyone to know that, I will continue to work with the county to bring as many doses possible to our residents in Orange County. I'll continue to share most of the current information we have on my website. So check out my website, and any questions that weren't answered today, my staff will go ahead and send the answers back to you so that you do have it. So I really appreciate everyone taking the time. And we are here fighting for you. This is really what we're dealing with 24/7. Know that. And things I think are looking up, and we're finally getting some systems down, and hopefully no more changes. Thank you.
Thank you. Another question we have, Dr. Chao, on when a person gets their first dose, is the second dose reserved for them at the time of their first dose, or how does that process work?
Thank you. That's how everybody asking that question. The guidance from the federal government and the state is that when the state and the federal government allocate the vaccine to a local county, they clearly indicate this is for first dose versus this is for second dose. And so the federal and the state governments do not want us to reserve the first dose for second dose. So there's a push to vaccinate as many people with the first dose as we can. However, we have seen some discrepancy in terms of the number of second dose that coming into the local county to finish the cycle for people. And so we are being cautious that we are telling providers that in some cases, if we don't have a second dose allocation, that they might have to use the first dose as second dose. So far, so good. So far, we are catching up okay. We don't need to push people second dose outside of the recommended cycle, right? So the cycle for Pfizer is 21 days, 3 weeks, and the cycle for Moderna is 28 days or 4 weeks.
Good. That's good to know. Another question we have is, how can we get a list of where to get vaccines other than SuperPods? You mentioned CVS and UCI, et cetera. Is there a website or somewhere we're giving out that information? And also, when can people expect to receive it from their primary care physician?
So let me answer the first one. The first one is a bit difficult because, like I said, it is still people, the health system are still vaccinating healthcare provider. So the individual hospital have to contact their own employee to offer the vaccine to. We do have several folks significant number of folks who are healthcare providers that are not attached to any health system. And that's the reason why originally we created the SuperPod, is to make sure that they have access to the vaccine. And we encourage those providers to enroll in Athena as well. And so in the mix of the Athena registration, there are 65 and older, as well as healthcare providers who are not part of a healthcare system, right? And so because we have limited vaccine, really, there's no list for you to go because you can't just walk in. It's based on appointment. And so we didn't want those sites to be bombarded with people who just show up, because we have seen it even on Athena and at the SuperPod. We encourage people not to show up if you don't have appointment. People still show up, and we have to turn people away. Number one. Number two, it just clogged up the line, and you just stay in there. We know at the Anaheim SuperPod site, we have to turn people away who have no appointments every day. And just people want it. It's a good thing, right? I can't wait to the day where vaccine limitation is not an issue, so you can just walk up and get your vaccine, as many as you can. The other piece that just got released today is that the federal government have just signed a contract with several pharmacies and will allocate vaccine directly to them for the non-long-term care facility. It's a test case. We don't know for California, the two pharmacies are Rite Aids and CVS, but the state is rolling it out on a test site. We don't know whether or not Orange County will be one of those test sites. We're waiting to hear where those locations will be. So I think at that time, then those pharmacies will probably send out an announcement on their own website for people to make an appointment. Again, it's not to walk in, but to make an appointment to go in for vaccine.
Supervisor Bartlett, one of the questions we have is there anything being done specifically for seniors who are unable to make it to one of the SuperPods in your district?
Yes. So basically, the SuperPod sites are great because we can get 3,000 to 5,000 people through a day. But I know that a lot of seniors are really nervous about going to a large venue with thousands of other people there, even though they've got face coverings on and they're social distancing. And people in South County don't necessarily want to drive up to Disneyland, even though they love Disneyland. So we've got the SoCa site, which is available, but that's another SuperPod site. We are now putting, the medium pods and mobile pods. We're working collectively with some of the local jurisdictions and the providers to actually get out into the communities, because there are a number of seniors that live in our communities. I have an entire city of Laguna Woods, essentially, that has, seniors 65 plus. So we want to be able to get the mobile pods right out into those areas where we have large areas of senior residents, because it's a lot more convenient where they can go to a site very close to them to be able to get vaccinated. So rather than the seniors coming to us wherever we're located around the county, we want to be able to come to them to make it really convenient. So as soon as we get more vaccines and more doses down to us, we're going to be able to have more of these mobile units and actually get out into the community at large, right to our seniors.
Great. Another question we have: I received my first shot and did not get a second appointment. When I logged into the Athena app, they automatically assigned me back to Disneyland, even though I live much closer to SoCa. Is there anything we can do to fix this?
You can send an email to Athena to change this, but because there's so much demand now, I would ask you, just for a little bit inconvenient, to go to Disney for now, just to make sure that your appointment is not slip away if you're in your transition and something happened. You might miss that chance. So I apologize that happened that way, but please, just for a little bit inconvenience, besides Disneyland, the happiest place on earth, right? So, but I mean, you have the option to call them and reschedule to SoCa, but I don't want to give you that advice and then something happened, you're going to call me up and yell at me. So
I think with 3.2 million residents to get vaccinated, if you did receive your first dose at the Disney pod site, I agree with Dr. Chau. I know it's a bit inconvenient to drive up there, but you don't want to miss that second dose. You don't want something going wrong in the system. So just take the extra time and get up to the Disney pod and get that second vaccine dosage.
Okay. We have a lot more questions to get through. We're doing good. This is an interesting one. When can schools fully reopen? Do we know? Assemblywoman Davies.
Thank you. Obviously, that's the number one question right now that we're waiting on. I think a lot of it has to do with the teachers and the safety. We're looking at stats and we're trying to, be at this level showing us, show us the science because it's showing that children are not getting this, they're really carrying it. But we know that, again, that's one of our number one priorities. We're watching the damage this is doing to our kids, the mental health issues, teens, a suicide rate going up. We've got to get our kids back in school full time as soon as possible. So I do know that they're looking at obviously getting vaccinations for the teachers and 18 and up. But I think that's one of the priorities. I mean, it's just doing too much damage and we need to get these kids back. They need to have structure again. And we're watching the numbers and we're watching the test numbers. I mean, 30% of them are failing. We've got to do something. So I'm hoping that our governor is listening. I hope that CTA is listening and that we can get our teachers safely back into the classroom so we get all our kids in there as well.
Sounds good. We've heard from the governor, I think last week or so, that there were some other areas of other populations that would be added, like I think agricultural workers and teachers and stuff. Supervisor Bartlett, Dr. Chau, or Laurie, how would that impact an already impacted supply of vaccines? Is there a plan to go along with that?
Well, that's the problem. So there hasn't been great communication from the state level. And so the governor opened up the 65 plus before we were done vaccinating the healthcare workers. And now the governor is going to potentially open up the next level, which are food service workers and so on, agricultural workers. That's another very large population. I want to make sure that we're able to get through the other populations first. I don't want to have to start splitting up, doses of vaccines with the different populations and not be able to get through our most vulnerable, which are our senior populations. So we really need to focus, and we've been very consistent with our message to the governor. Look, give us more vaccines. We will get shots in arms as quickly as possible, but don't just keep opening up different phases prematurely when you're not giving us the vaccine doses, because we want to be able to vaccinate those that are most vulnerable. And right now, those are our seniors 65 plus. So, we're pleading with the governor for more vaccines, but also be cautious on opening up the phases too quickly, because the counties don't have the ability. We don't have the bandwidth to open up more super pods because we don't have the vaccine doses. So it's kind of a chicken and egg kind of thing. And we are being very, very vocal about this. In addition, the governor is putting in another layer of administration. We want to get the doses of vaccines down to the counties and get shots in arms as fast as possible. The governor has now implemented a Blue Cross and Kaiser third-party administrator, and that is going, in our opinion, to slow the process down when you've got another bureaucracy that you've got to go through to get your doses of vaccines. So the counties are being very vocal with the state saying, look, we just get us the vaccines, we will get them figured out at the local level and be able to vaccinate our population. But to go through from the state, from the federal to the state, from the state through a third-party administrator, and then down to the counties, it's another added step that we just, frankly, we don't need right now. And it's going to delay the process, and it's going to delay the reopening of our economy. We need to get our economy reopened as soon as possible. Sure. And right now, with all the layers of administration and bureaucracy that we have to go through, it's slowing things down. It's not making things better.
And if I can echo Supervisor Bartlett's as well, there's a disconnect with the governor and the legislation up here. Again, we don't even hear what's happening sometimes, until 30 minutes before he goes out and announces something. So nobody has any time to figure out what we're going to do, how we're going to implement it. So again, that's where that frustration is. So we need to have communication. Again, we don't need another third party in here. We're finally getting something organized. So, if we could get the governor to actually, focus, talk to the legislators up here so we have an idea what's coming down the pipeline so that we can let the counties know as well, instead of us all finding out at the same time. Thank you.
While we're with you, Assemblywoman Davies, there's a question here wanting to know if, do you have any idea if there's a plan at the state level to help reopen or revive live arts in Orange County?
I could tell you right now, I think it's like trying to reopen anything. It's just kind of sitting there right now. And right now, the answer you're going to get is we need to get the vaccination out there right now. So, and I think that's what's going to happen is they're not going to let people gather. Everything's still Zoom until we feel that our numbers are going down. UCI numbers are going down, and we're doing something. And it's frustrating because we need our arts back up. I mean, we need everything up. To me, every single business is essential,
Sure.
And if, what essential means to me is something that puts food on the plate, someone that's employing jobs for people. And again, and that is, like I said, with the sports, with the arts, this all is for mental health. And we need to get this moving. And I think we have to start looking at the stats as well, because again, many other states have been open and, and following the guidelines, especially like let them play. Other states are using the guidelines. There's no reason why we can't sit there and look at what they're doing and duplicate it if their numbers are looking good. So, all I can say is, write to the governor. We're here trying to do whatever we can, putting pressure on him. And I'm hoping, he'll start listening.
Sounds good. You mentioned earlier about third party. We have one question in here. How will Governor Newsome's new deals with Blue Cross and Kaiser affect our county's local control of vaccine distribution? Any thoughts on whether this will help or hinder the process? Assemblywoman Davies, or?
Honestly, I'm not sure how it's even going to go that route. It's, we're just trying to get distribution. And what I'm hearing too is, the question is, who decides what each county gets when
Right.
it comes to this?
Right.
And so a lot of them, from what I was told today, is that they're taking the number of healthcare workers and assisted living and healthcare homes. And they're looking at who has the most in each county, and that's where the doses are going. I'd like to have clarity on that a little bit more, and I think all of us would, because honestly, I don't think that Orange County and other counties are getting their fair share of what we should have down here. So it would be great, again, to have accountability from the governor, being very specific into why, and just like this $1.2 billion, how's that going to be divided that the federal government is giving us to be able to use? So we need to have accountability coming from our governor.
Understand.
And oversight.
Sure. Thank you.
I personally think that third-party administrator with the Blue Cross Kaiser, while it may sound okay in concept, it's another layer of bureaucracy that frankly, we don't need right now. The counties have been working very efficiently of getting our doses, getting shots in arms, and we can continue to do that. We just tell the governor, give us the vaccines at the local level. We will make it work. We will set up our super pods. We will set up our dispensing sites. We'll go in mobile units out into communities, but don't put in another layer of bureaucracy that is going to slow the process down, because every day we get slowed down is a day we can't fully reopen.
Right.
That's right.
Another question we've had, Dr. Chau, on the vaccines that are currently on the market right now. How effective are they against the new variants that are out there?
So as far as we know, there are 4 variants that people are talking about: the Californian one, the South African one, the UK, as well as the Brazil. So far, we know that Pfizer and Moderna are still very effective in dealing with that variant. But again, the manufacturer are very cautious, and they are discussing on possible a 3rd booster shot. I have to mention it because you'll probably have heard about it on the news.
Yes.
We have to wait and see. Earlier, Assemblywoman Davies mentioned two more new vaccine. Supposedly, Johnson & Johnson will be submitting their application by this weekend, and AstraZeneca perhaps early next week. If that occurred, then within 2 weeks, we will have more new vaccine coming to Orange County. My goal is the more vaccine we get, the faster, the more people we're going to be able to push in on and push it out, because the goal is to really celebrate in a big way on July 4th. I think Supervisor Bartlett, you promised that we'll have a big celebration in your district by July 4th, right?
Operation Independence,
Yes.
with vaccinating our 3.2 million residents, is successful. Absolutely. We will definitely celebrate and look forward to bringing Assemblywoman Davies and
Yes.
healthcare agency staff and celebrating in the community at large. I mean, we really want to beat this COVID-19. I think we're over the hump now. We've gotten through all of the spikes, and all of the counties now are, their 4-week lookout is actually looking better. The ICU capacities, they're going down as far as the number of beds being occupied. The death rate is starting to come down. We're making significant progress, but in order for us to get to that next level, we've got to be able to get that, what they call the herd immunity, get enough people vaccinated so they don't get COVID-19, and we really slow the spread down to almost nothing. So we're going to do everything in our power to make sure that, you know, we vaccinate, and we can only do that if we get those vaccine doses. And we are doing everything in our power to get more doses from the state, push to get more doses from the federal level. And with the new vaccines coming out with AstraZeneca and Johnson & Johnson, that will help increase the number of vaccinations that we can all do on a daily basis. So we're really looking forward to that.
Okay.
Pauline, do we have any more questions?
We are actually, I'm very cognizant of your time, and thank you all for answering the questions that you have. I think we can give a 30-second wrap up for each one of you, if you would care to give a closing statement.
Okay, we're going to start with Assemblywoman Davies.
Thank you. Again, I appreciate everyone coming to this event. This is our priority, the safety of 5th District, 73rd, and we just want to make sure we can get these doses out to you. So please, as a reminder, if your questions weren't answered, we'll get back to you. You can go to my website. We'll keep you updated on that as well. And, you know, you can also contact my staff. We're here to help, but #1 priority, getting this up. And I can tell you, we will continue to keep pressure on the governor to hopefully simplify this so that we can get the vaccinations into the hands of the county where they know what's best for those that they represent.
Okay. Dr. Chau?
Thank you for this opportunity, Supervisor Bartlett and Assemblywoman Davies, to speak to the community. 2 things. First thing first, please be patient. As sooner we get more vaccine, I promise you we're going to push it out as fast as we can. Secondly, please continue to wear your mask, keep physical distancing from folks, and practice all those hygiene, because as long as we have not achieved herd immunity, and you probably heard that number around, that number is roughly around 70 to 80% of people in the community have achieved herd immunity via the vaccine. We still need to do this. So for those of you who've gotten your vaccine already, it doesn't mean that you can take off your mask. It's more important that you have to continue to wear your mask to protect those who have not gotten the vaccine yet, especially when we talk about all these new variants that are appearing slowly into the United States. These new variants are spreading very fast. So you got the vaccine, you will see the virus if you're not careful, but you won't get sick, but you will be able to spread it to somebody else. So please continue to wear your mask. Thank you.
Okay. Well, thank you.
Supervisor Bartlett.
Yes, thank you. So I want to thank Assemblywoman Davies for joining us this evening, and thank you, Dr. Chau, for joining us as well. And thank you for everybody who has tuned in. It's so important to get information and to be able to, you know, tell your neighbors what's going on, because we can't get out to every person in the community, but we're doing a lot of great work at the county. We hope to set up more SuperPod sites and get vaccinations done as quickly as possible. The Athena app is not perfect, and I'll be the first to admit that, but it is getting a lot better, and it's certainly better than what they're using at the state level and in Los Angeles County right now. So thank you everyone for tuning in. Again, if you have any questions, we're always there to support and to help you. So don't hesitate to call Assemblywoman Davies, to call the healthcare agency, to call myself or our board office. We will get the information for you and be able to assist you, not so much with scheduling your actual appointment, but we can answer a lot of your questions. And I know everyone's got a different question, so really pick up the phone, send an email, get in contact with us, because we are your resource. We want to be there to help you through this process. And if you have any other questions relating to the county or the state, add those to the email as well while you're at it. We want to be there as a resource. And again, thank you for tuning in this evening. We want to vaccinate all of our residents as quickly as possible with the new vaccines coming out. That's very hopeful. We were keeping on top of the state with the governor and his administration to make sure that they try to get vaccines out to the counties as quickly as possible so that we can handle things here at the local level. We all believe local control is best. We advocate for that every single day because the counties know what it takes for the residents, and we're doing everything we possibly can. So have a great evening. Thank you for tuning in, and I'm sure we'll all talk again soon.
Thank you all very much.
Thank you.
Thank you.